Hello, greeting to everyone. Today I'm going to talk about one of the eating disorder which is called anorexia nervosa. Anorexia nervosa is primarily a psychological disorder, not just a cosmetic issue. While it may appear related to wanting to look thin, but the core problem is psychological. It involves distorted body image. It means seeing oneself as overweight even when underweight. Intense fear of gaining weight, need for control, perfectionism, and anxiety. These individuals may not simply refuse to eat, they often experience altered taste, appetite, and fullness, making eating emotionally distressing. Eating can trigger anxiety, panic, or depression, so individuals restrict food intake. People with anorexia are not simply trying to improve appearance. Their eating behaviors are driven by deep emotional distress, anxiety, and cognitive distortions. They often use food restrictions to cope with feelings or gain a sense of control. So again, if you see at the slide, it says what is the issue, and now we understand. Anorexia nervosa is a serious psychological or mental health disorder with physical consequences, not a cosmetic or appearance-based issue. Okay, let's talk about compensatory behavior, which is purging. Yes, in context of an eating disorder, purging can include excessive or compulsive exercise. Purging behaviors are actions used to try to compensate for eating or prevent weight gain. These can include self-induced vomiting, misuse of laxatives, diuretics, or enemas, fasting, or severe food restrictions after eating. So what is excessive or compulsive exercise? This is an exercise considered a purging behavior when it is done primarily to burn off calories after eating, which is driven by guilt, anxiety, or fear of weight gain. This exercise may be excessive in duration or intensity relative to person's health and fitness. They continued this exercise despite illness, injury, or medical advice to stop. These exercises interfere with work, school, relationships, and normal daily life because they're spending 2 to 3 hours doing this exercise. Let's discuss the behavior shown by a person who has an eating disorder. For them, food feels threatening, not rewarding. It means that a person experiences fear, anxiety, or guilt about eating instead of the normal feeling of pleasure or satisfaction that food normally provides. In the context of anorexia nervosa, eating may trigger intense fear of gaining weight. Meals may cause anxiety, panic, or guilt. The person may avoid food because they see it as dangerous to their goals of staying thin. Instead of looking forward to eating, they may dread meal times. For example, for most of the people, I'm hungry, eating lunch will make me feel better. Someone with anorexia nervosa, if I eat lunch, I'll gain weight. I should skip it. So what we can say, the simple definition, food feels threatening, not rewarding. Means the person view eating as something to fear rather than something enjoyable or nourishing. They associate food with weight gain, loss of control, or guilt instead of pleasure and health. This change in thinking reinforces food restriction and makes the recovery more difficult. The other behavior they're shown is the thinking becomes rigid and obsessive. It means that a person's thoughts become inflexible, repetitive, and difficult to change. even when there is evidence that their beliefs are unrealistic or harmful. So, the rigid thinking is when the person has difficulty considering others' viewpoints or adopting to change. For example, I must get a perfect score or I am a complete failure. And the obsessive thinking, when the person has persistent intrusive thoughts that they cannot easily stop thinking about. For example, constantly thinking about calories, weight, body shape, or checking the mirror repeatedly. The person who is medically underweight looks in the mirror and says, "My stomach is too big. I need to lose more weight." Family and friends see them as very thin, but they continue to believe that they are fat. So the distorted self-image is an inaccurate view of one's body or appearance, causing a person to see themselves different from reality. A distorted body image is a hallmark feature of anorexia nervosa. Even after significant weight loss, the person often continues to believe they are overweight, which reinforces restrictive eating behavior. Let's look at the risk factor which leads to anorexia nervosa. Under the biological factors, the first one is genetic, and there are 50 to 60 chances of heritability. The researchers found genetic correlations between anorexia, major depressive disorder, anxiety disorder, OCD, and schizophrenia. They also found a correlation between anorexia and variations in glucose and lipid metabolism. Neurobiological risk factor also come under biological factors, which you can see here. There is a serotonin imbalance and there is change in a brain structure. Cognitive factors is perfectionism. They want to be perfect in everything. There is a need for control. They have a low distress tolerance. These people, they value their disorder. Although they know that their actions are potentially harmful, they believe that the benefits outweigh the harm. The third risk factor is the environmental factor. Anorexia nervosa is associated with a culture that value thinness. Culture pressure for thinness, social media influence may also a risk factor. So the sign and symptoms of anorexia nervosa, the low body weight. We usually look for the BMI, how severe the disease is. If BMI is very high, the disease is very severe and may need a hospitalization. The physical signs you can see is a lanugo. These are the fine hair, soft, thin, downy hair that grows on the face, arms, back, and body. Because there is a very little body fat, the body cannot stay warm, so the body grows lanugo that help in conserving heat. So the lanugo is a classic physical findings in anorexia nervosa. Next, we look at the cold skin. The skin feels cool and cold to touch due to loss of body fat. Loss of body fat reduces the insulation, slows down the metabolism, and decreases heat production. Reduced blood flow to the skin contributes to feeling cold. Patients often complain of feeling cold even in a warm room. Low blood pressure, which is also called hypotension, is due to dehydration, poor nutrition, reduced heart function due to starvation. People may feel dizzy, fainting, weakness due to low blood pressure. Bradycardia is a low pulse. Heart rate may be less than 60 beats per minute. The reason again for that is a starvation, which slows down the body metabolism. The heart conserves energy by beating more slowly. A very slow heart rate can become dangerous. Low body temperature, which is also called a hypothermia, which is a body temperature below normal, and the reasons for that is a little body fat, decreased metabolism, unable to generate enough heat. Patients often wear extra layers because they feel cold. And hormonal changes, which is most common, is amenorrhea in girls. Severe weight loss decreases body fat. The brain reduces hormone inducing estrogen level production to conserve energy. This can affect fertility and bone health. Although amenorrhea is common, it is not required to diagnose anorexia nervosa. They have some other medical complications due to starvation, the electrolyte imbalance. Electrolytes helps for muscles, nerves, and heart function normally. So if they are starving and they have a electrolyte imbalance, so these imbalance can include low potassium, hypokalemia, low sodium, which is hyponatremia, low phosphate, which is hypophosphatemia, especially during the refeeding. Watch for the refeeding. The causes for these electrolyte imbalance are starvation, also vomiting, and the one we just talked about it, laxative or diuretic misuse. They may get complications like a muscle weakness, irregular heart rhythms, cardiac arrest in the severe cases, and that's most common reason of these patients dying. Bone loss, which is osteopenia or osteoporosis, this again happens because of the low estrogen level, calcium and vitamin D deficiency, chronic malnutrition, bone becomes weak and fracture more easily. Young adults with anorexia may develop osteoporosis much earlier than expected. Okay, so let's talk about anemia, a decreased number of RBCs or hemoglobin. And again, we know because they are starving, they have a poor intake of iron, folate, and vitamin B12. Bone marrow suppression for prolonged starvation, and the symptoms for anemia, fatigue, weakness, pale skin, and shortness of breath. In a next slide, we will summarize all the symptoms with a term starved. So let's go to the next slide. So this is what the starved is. So it's just so that it's easy for you to remember. S is slow pulse, low temperature, low metabolism. T is thin body with low BMI. A, amenorrhea and anemia. R is reduced blood pressure. V is a vitamin deficiency and electrolyte imbalance. E is electrolyte abnormalities, and D is downy hair, which is a lanugo, and decreased bone density. So D is downy hair and density. So see, these findings reflect how prolonged starvation affects nearly every organ system. So we'll do the journal assessment based on what we just have studied. We'll find out what are the perception of the problem, what's the psychological issues behind that, what are their eating habits, which will tell us how much nutrition they are taking, their history of dieting or purging, how they are controlling, what are the methods they are using to control their weight. Are you doing a purging or doing excessive exercise, value attached to specific shape and weight. So what they are thinking about their weight should be, what is their goal. So if we can find out, that will be great. Interpersonal and social functioning, how is their daily living, daily activities, what's their mental status and their physiological parameters. So for that, we make sure we do a labs to find out if there is any deficiencies which we can correct. So this is all journal assessment. We do it with this patient. So these are the nursing diagnoses. What we do is, after analyzing our assessment, analyzing the labs, we go ahead and do nursing diagnosis. These are the some common nursing diagnoses related to assessment, and then we can have some other diagnoses also. For example, disturbed body image, ineffective coping, chronic low self-esteem. So the hospitalization criteria, usually we have to hospitalize them because these severe physical symptoms can be lethal. If they have lost more than 30% of body weight within 6 months, then we have to admit them. Also, if their ideal temperature below 36 centigrade, heart rate less than 40 beats per minute, and systolic blood pressure less than 70. So these are some of the criteria we hospitalize them. Other thing I really want you to look into is to determine the patient's perception of the problem or chief complaint, whether they understand they have a problem or not. And then we do a nursing assessment, including orthostatic vital signs, review of system, and general appearance. Also go ahead and gather psychological history. If they have history of any suicidal thoughts or self-harm behavior, we need to know those things also. Okay, we may have we may need to do x-ray to check for the bones. If there is osteoporosis, we have to do a ESR. So all those symptoms we done before, we have to do all the labs related to those symptoms. So the interventions involved, the first one is the safety. Yes, we'll watch for suicidal ideations. Make sure if they have those ideation, you keep the milieu safe. Then the priority intervention, the safety, we don't want them to die because of the starvation. So the first thing is to restoration of weight and normalization of eating pattern. This requires a close supervision of clients' eating and prevention of exercise, purging, and other activities. Observe the client during and after meals to prevent throwing away food or purging. Monitor all trips to the bathroom. Meal times are structured, not flexible. Weighing is performed on a regular schedule. Privileges are correlated with weight gain and treatment plan compliance. Their treatment may include inpatient, outpatient, or day program. Their key components are weight restoration. Our goal is 90% ideal weight. Nutritional therapy, they might need the feeding tubes if they are very low in weight. Psychotherapy, which includes CBT, family therapy, and medical monitoring. We do not have any FDA-approved medication for core symptoms. We can use the drugs which can treat the associated conditions. Only care which is involved is a teamwork approach, which includes the teamwork between nurses, dietitians, and therapists. Treatment modalities. Research does not support the use of pharmacological agents to treat the core symptoms of eating disorder. Some psychotropic medications is utilized to treat associated symptoms. For example, if they have co-occurring disorders, can be used SSRI, anti-anxiety agents, second degree antipsychotics, and mood stabilizer. So here I would like to say that eating produces high anxiety for clients with eating disorder. So their anxiety level goes really high when we force them to eat. Anxiety level must be lowered if the client is to be successful in attaining a therapeutic goals. So we can use anxiety medications to lower their anxiety level. The psychiatric mental health advanced practice registered nurse can assess, diagnose, and treat anorexia nervosa, and some also specialize in eating disorder. They provide education and support through individual, group, or family therapy and may facilitate complex group therapy. There is no strong evidence supporting a specific psychotherapy model for adults with anorexia nervosa. In adolescents, psychotherapy have shown benefit. Effective approach in adolescent includes inside-oriented individual therapy, which improves the self-understanding. Family-based treatment, which helps the parent manage eating behavior and support weight restoration. Usually they do it in a 6 to 12 weeks of outpatient treatment or outpatient therapy. Then the adolescent focus therapy, which is AFT, it emphasizes the self-monitoring and weight gain with therapeutic support. Cognitive behavior therapy, CBT, it targets and challenges the negative thought pattern.